Session 4, HIV-related counseling. In this session, we will discuss fundamentals of counseling related to HIV/AIDS, including importance and principles of counseling, pre-test, post-test counseling, counseling for HIV prevention, treatment, and adherence. By attending this session, the participant will be able to define the term counseling and differentiate between education and counseling. Will know characteristics of a good counselor in a counseling session and key principles of counseling. The participant will be able to provide pre-test, post-test counseling to HIV negative and HIV positive patients, counseling for HIV prevention and ARD adherence. First of all, we must define the term counseling. It is a confidential dialogue between an individual or a couple and a counselor, aimed at enhancing individuals' abilities to make the informed decisions. The counseling assists HIV-infected patients and their families to manage difficult situations in their lives and find doable ways to solve their problems within available resources. Difference between counseling and health education. Health education is the provision of fundamental information related to the prevention and treatment of HIV/AIDS and related illnesses, but it is one-way communication, while counseling is a two-way communication or dialogue between the client and the counselor. Characteristics of a good counselor: be a good listener, ask appropriate questions, summarizes what the client has said by repeating client's words to confirm the issue, provides relevant information, provides emotional support, helps or facilitates in decision making, doesn't interrupt while the client is talking, provides friendly environment, provides privacy and ensures confidentiality, shows empathy, is patient during whole discussions, doesn't argue or criticize, and is not judgmental. Characteristics of good counseling session: client satisfaction and consequent positive changes in behaviors of the client are two major outcomes of a successful counseling session. Characteristics of good counseling session include confidentiality. Trust is one of the important factors in relationship between a counselor and a client. It improves working relationship and increases the likelihood that the client would act on the information provided. The counseling relationship must be built on understanding that the discussed matters will remain a private issue until the client decides otherwise. Time. Providing enough time to client is important. Time is also necessary for development of understanding and trust. Some people may require a number of sessions before they start to acknowledge the need to modify behaviors and to make difficult decisions concerning their life. Acceptance. People, irrespective of their lifestyle, sexual preferences, socio-economic, ethnic, or religious background, should feel fully accepted by counselor. Accessibility. Services must be available easily. They must be based in ERT centers or health facilities that are easily approachable. People who need counseling should feel that they can ask for a meeting when need arises. Active listening. Active listening means catch not only the words people say, but understand their body language. That means non-verbal communication, and respond appropriately. Key principles in counseling. Number one, client-centered decision making. Allowing clients to make their own decisions, counselor needs to facilitate the client only, not to make decisions for them. Second is empowering people. Encourage people to believe in themselves and their abilities. Counseling should help people to take control over their lives and set goals for their future. Steps a counselor follows in providing counseling. Number 1, exploring the problem. Counselor must help the client to describe actual problem and express his or her feelings. The counselor could do this by active listening, by asking appropriate open-ended questions, and by encouraging people to share their feelings. Number 2, understanding the problem. The counselor should help the client to gain a clear understanding of the problem and consider the different options to solve the problem. The counselor could do this by explaining appropriate options and by encouraging people to look at the consequences of each option. Number 3, taking actions. The counselor should help the clients to decide what step to take to implement their decisions and overcome difficulties that may experience in taking action to solve the problem. Purposes of counseling: to prepare client for HIV testing, to explain HIV testing procedure and number of tests for confirmation, to prepare the client for HIV testing results, including positive and negative results, to prevent HIV transmission, to provide psychological support to manage stress of affected people and their families, to provide important information related to HIV/AIDS and address the questions and concerns of the client, to facilitate HIV-infected person to disclose his or her HIV status to spouse or family to get their support, to improve self-esteem so that HIV-infected individual makes valid contribution in the society. Pre-test counseling. Pre-test counseling provides information to individuals about why HIV testing is important, the testing procedure, and various implications of being diagnosed as HIV negative or HIV positive. Often risk assessment of the client for HIV is done. The client himself or herself decides if she wants to get tested for HIV. Summary of the contents of the pre-test counseling session. Personal risk assessment for HIV, a reason for HIV testing, importing basic information about HIV, provision of information about HIV testing procedure, discussion on possible results in relation to individuals' risk assessment, discussion on risk reduction strategies, informed consent, follow-up arrangement for collection of results, and other referrals. Post-test counseling. Post-test counseling helps the client to understand and manage with HIV test results. The counselor should prepare the client for results before breaking the results by providing peaceful and friendly environment, ensuring privacy and confidentiality. The nature of post-testing counseling depends on the test results. Negative HIV results. Counsel after negative test results, focusing on behavior change to reduce the risk of future infections. Educate the client on safe sex and safe injection practices. Positive HIV test results. Counselor needs to disclose the HIV test results with client in a clear and gentle way, without any speculation. What the news mean should be clearly described. Counseling for ART adherence. Treatment adherence means starting up HIV treatment, taking medicine on regular basis, and exactly as prescribed by ART physician, keeping all medical appointments. The counselor needs to explain the client why adherence is necessary and what are consequences of non-adherence. Inform the patient taking HIV medicines every day regularly prevents HIV multiplication and reducing HIV viral load to undetectable level, reducing chances of transmission to others almost zero. Skipping HIV medicines allows HIV to multiply, which increases the risk of drug resistance and HIV treatment failure. Disclosure of HIV status to family or spouse. It has been observed The disclosure of HIV status to spouse and family decreases the stress level of the HIV infected person. She gets spouse family support to cope up with the stress and gets help with treatment and care support services. Finally, at the end of session, key points to remember. Counseling is an important intervention in mitigating the psychological impact of HIV and AIDS on the individual, family, and community. HIV counseling includes pre-test, post-test counseling, ART adherence counseling, bring change in risky behaviors counseling, counseling to cope up with HIV-related stress, counseling to disclose HIV status to spouse or family. Knowledge, skills, techniques are important aspects for one to be an effective counselor.